Hello. Hey, this is really a very simple video. Actually, I mean, we should simply have Medicare for all, universal health coverage, full coverage. There was a Yale study done a couple years ago, I guess, while Bernie Sanders was running for office, and it showed that, Medicare for all would be about half the price of what we have right now, uh, and would, of course, save lives, particularly during a COVID pandemic. We don't have it because, we live in a profit-driven country, and, it wouldn't, be good for profits, and our most of our politicians are owned by big pharma and also insurance companies, and it's not in their interest to uh, serve the public. So that's why we don't have it. And even though there's a guy over at, I don't know if he's still there at Johns Hopkins University. I think his name's Vincente uh, Navarro. Matter of fact, let me just check. I'm looking it up. I'm googling it. Yeah, Vincente Navarro. He is an MD, PhD, and he teaches over there at Johns Hopkins. I actually contacted him one time, but I wanted to interview him for a YouTube interview. Noam Chomsky actually told me about him, but he um, didn't really want to come on with me. Corporate medicine. Let's see. I have several of his books, and of course, other people write about this too. Medicine. Let's look it up. And just the price of he does have a book recently, 2004. He had political and economic determinants of population health and well-being. Uh, Vincente Navarro. Let's put in Vincente Navarro. And what Obama gave us, right? It was not really that great. Oh yeah, he has Imperialism, Health, and Medicine, which he wrote way back in 1981. Uh, Embodying Inequality. Trying to find his books in particular. Okay, here he goes. So he wrote The Political and Social Context of Help, uh, Dangerous to Your Health, um, Medicine Under Capitalism, which I think is a great book, and so many other ones. Yeah, I think Paul Krugman one time said that, you know, it's the moral thing to do. Paul Krugman seems to have gone a little bit neoliberal, and of course we have a neoliberal government, so yeah, they're not for uh, uh, universal health coverage. We should just have it. Like, for example, I'm a licensed clinical social worker. I work as an independent contractor in New Jersey. I get my own health insurance, and it's really expensive. It's like $50 a month, and I still don't get total coverage. I mean, it's insane. Of course, we should have it. It's a no-brainer. Most countries have it, and, they talk about how, well, if we got it, it would be huge waiting lists, waiting lines. Even, uh, Joe Biden sort of lied about it in the campaign. He was talking about how, it would be more expensive. I don't know if people remember that, uh, but it's just not true, and any attempt to get it is always blocked. But I think we as the public, we have to fight for it, because even this guy who won here in Pennsylvania, John Fetterman, he was talking about how we should have access to health care, but that seems to be the phrase that people use, access to we all have access to health care. I mean, we can go to the emergency room or we can go to these urgent care places, but that's not really health care. We should have a universal system, and I think most of the public really wants it anyway. So you have to ask yourself, why don't we have it? And I'm gonna obviously do more videos on this one. This is obviously a major topic, and so this is a short one, but do it again.